This is Dr. Seth Gamrat at USC with arthroscopic superior capsular reconstruction. As you can see, there's many different treatments for massive irreparable rotator cuff tears. The superior capsular reconstruction is a joint sparing option. The patch spans from the glenoid to the greater tuberosity and restores superior stability to the glenohumeral joint. Long-term results aren't known, but short-term results are promising. You want minimal X-ray changes, no fixed high-riding humeral head. This is a view from the posterior portal. As you can see, I'm tugging on the rotator cuff. Now viewing from posterior, tugging from lateral. That rotator cuff is retracted, atrophied. It's never going to make it to the greater tuberosity. Here we're viewing from lateral, inflow from posterior. I'm going to do a very minimal subacromial decompression here just to smooth out the roof so that the graft has something to articulate with. Take a 4mm barrel burr and smooth out the undersurface of the acromion while preserving the coracoacromial arch. Next thing we're going to do is prepare the superior glenoid. You can see I'm taking a shaver here, debriding the non-viable rotator cuff off of the superior glenoid and preparing the bone bed with a heat probe. Next, we'll come in through Nevisor's portal and place a 3.0mm biosuture tack from Arthrex. This is doubly loaded. Come in anterior to the clavicle this time and place the anterior superior glenoid anchor. To simplify the procedure, I'll remove one suture from each of those anchors. Next, we're going to prepare our greater tuberosity with a light decortication. And then we're going to size the graft using the Arthrex size probe. Size it in 3 different planes, anterior, posterior on both the glenoid and humerus, as well as medial, lateral. Now we'll place our medial row anchors on the greater tuberosity. These are 4.75mm swivel lock anchors, preloaded with fiber tape. One anchor anterior, one anchor posterior. Now that the medial row anchors are placed, we're ready to start working on our graft. This is a view from the lateral portal. We're going to bring in a passport cannula. This really facilitates graft passage. And then we'll bring the sutures out to get all 4 sutures organized so we can pass them through the graft outside of the body. We make sure that we have no tangles at all in that passport cannula. Then we're going to prepare the graft perfectly sized. I pre-punch it.
Yeah, a little bit.
Pass all 4 sutures through and then push it in the joint with a grasper. Here comes the arthroscopic view. Even though the Graft is prettier on the smooth side. We keep that smooth side down facing the articular cartilage. This is an Arthroflex patch. Human acellular dermis. Now we've shuttled the graft into position using the limbs of suture from the glenoid anchors, and we'll go ahead and tie the knot down arthroscopically medial and cut it. Next, we'll get organized with a speed bridge configuration laterally. Inserting 2 swivel lock anchors to compress the lateral aspect of the graft down to the greater tuberosity, and then we'll flush cut the fiber tape sutures. You can see now the graft is in position. It's going to be uncontained anteriorly as there's nothing to sew it there to, but now we can sew up the posterior edge of the graft with the native remnant cuff. That's what we're going to do next. And there's our speed bridge configuration laterally. I use a combination of scorpion suture passage and birdbeak suture passage to pass simple sutures between the graft and the native cuff. Typically 3 or 4 sutures are used to suture the posterior cuff to the graft. Taking a bite of cuff there, followed by a bite of graft, and then tie this knot down. Once again, bite of cuff, bite of graft, tie the knot down, zipping up that seam. So here's a bite of graft. Come in with a penetrator, retrieve that suture from the bottom of the graft, and then tie it over the top, completing the repair. Patient will go in a sling for 6 weeks, gentle range of motion only, and go for strengthening between weeks 6 and 18. Final view of the graft, viewed from lateral. Final view of the graft viewed from the undersurface, showing the seam between the cuff and the graft.